On the Medical Watch, stopping PTSD. A local pain medicine specialist says he can inject a sense of calm into patients. Critics are waiting for results from a formal study. Meantime, hundreds of people, many military personnel, say they've been saved, including a woman with nightmarish injuries who traveled to Chicago because she says she knows this treatment works.
On top of my hands and then my arms, all the way back onto my shoulders.
Burns, the former U.S. Army nurse, suffered in a horrific attack while on the job. First Lieutenant Katie Blanchard's story received national attention. She says for months she warned her superiors about coworker Clifford Curry's disturbing and aggressive behavior toward her at Fort Leavenworth in Kansas, where both worked in the community hospital.
Right away, I was very frank with them and told them, I don't feel safe. I think that he is going to attack me. I don't feel safe. And I felt that he was going to bring a gun into work.
He didn't. He brought gasoline. In September 2016, Katie saw the civilian employee she supervised approach her out of the corner of her eye.
It was in a water bottle, but it was brown, and I could smell it. And right away, I knew that he was going to try to kill me. And he doused me with the gasoline, threw 2 lit matches on me, and lit me on fire in my office while I was still sitting at my computer.
Katie has undergone more than 100 procedures. Skin grafts from her lower body have helped heal the 18% of her upper body burned in the attack.
So that's the physical aspect, but the mental aspect of it, you know, psychologically, it was so hard. I couldn't sleep at night. I had terrible nightmares and flashbacks. I always felt like I was kind of revved up or always on guard, and I could never fully relax.
Say it again.
Is IV in?
IV's in, yes.
When we met the mother of 3 young boys, she wasn't prepping for another skin surgery. Instead, she was in Chicago to receive an old procedure with a new purpose. Katie is in therapy and takes medications to help her cope with post-traumatic stress disorder. But 2 years ago, she was offered something else, the stellate ganglion block, or SGB, a procedure pain medicine specialist Dr. Eugene Lipov has long championed as an effective treatment for PTSD.
This very visceral peacefulness just came over me, and that I didn't feel anxious. I didn't feel that constant anxiety that I had been holding in.
The effects lasted about a year, so she came back for another round with Dr. Lipov. 13 years ago, Dr. Lipov began using SGB to treat military personnel suffering with post-traumatic stress disorder, a story we covered back in 2008. Since then, he's performed the injection on more than 350 active duty and retired personnel. But along the way, he's faced deep skepticism and opposition with the medical community.
Yes, for many, many years, that's very true. Yeah, it's been a long road, but I think we're getting there, finally.
The U.S. military, now faced with staggering suicide rates among veterans, was slow to offer the procedure broadly, even after Dr. Lipov published his early promising results. More recently, the Department of Defense has funded a formal study at 3 U.S. military bases. The findings are expected to be published in the coming months.
We've seen so many people's lives transformed. Some people have been saved from suicide by doing this, thankfully.
An X-ray helps guide Dr. Lipov's hand as he navigates the needle to his target in the cervical spine, the stellate ganglion, a bundle of nerves known to help regulate our fight-or-flight response in the brain, which is on overdrive in patients with PTSD.
That's the needle going in.
There, he injects a local anesthetic, the same drug used for an epidural during child delivery. The numbing agent lasts for about 8 hours at the injection site, but Dr. Lipov says the effect on the brain can last for months to years.
When you do an injection here, it turns off the fear part in the brain here.
It's made a huge impact in my life.
The cost of the procedure is $2,000 and it's not covered by insurance, but Dr. Lipov offers military personnel a discount, and he's established a non-for-profit organization called Erase PTSD Now to help patients pay for their treatment. You can learn more on our website. As for Katie's attacker, he was convicted of intent to commit murder. He's serving a 20-year sentence.